Thank you very much. I'm appreciative to be able to present to you today, really is representing a team effort. And the team effort involves Dassault Systèmes, but Harvard Medical School as well. And this began, I want to recognize Phil Borchard, whom I met maybe 6 years ago, and then he reconnected with me a few years later, and our discussions led to this project that we're going to share with you today. And special appreciation to Steve Levine, who really maintains close contact with our progress. And Joe Baldwin, who leads our effort on a bi-weekly basis. So our primary interest is to understand the cause of some important forms of blindness. And I'll start by saying glaucoma, which affects 1 to 2% of the general population. And another condition called NION, or non-arteritic anterior ischemic optic neuropathy. You might think of it like a stroke of the optic nerve. So not the stroke in the brain proper, but the optic nerve connection between the eye and the visual part of the brain, NION. So when NION occurs, here I'm looking at the back of the eye through a dilated pupil of a patient. The optic nerve is circular. It takes all that information that we heard about yesterday from the, earlier from the retina, passes it to the brain through the optic nerve, which has this circular appearance. When a stroke occurs of that nerve head, it becomes swollen, and these hemorrhages develop. So we know exactly where the problem is. And often, when one loses vision from NION, oddly, you lose 1/2 of your vision, lower more typically, but sometimes in the upper part. What's really peculiar about this is that the back of the eye here, this is the optic nerve head. Those axons from the neurons in the eye that form the optic nerve, those axons go from the eye down the optic nerve into a structure called the chiasm and all the way back to the lateral geniculate body. In other words, these axons go halfway through the brain. And over that long extent of roughly 80 millimeters, ischemia, or blood flow problems, almost never occur. They occur almost exclusively at the optic nerve head. So there's something very local that's problematic in delivering blood to this critical connection between the eye and the brain. Well, people have been interested in these blood vessels for centuries. Here, Zinn in 1755 made these incredible images. He was both an anatomist and an artist, and he cut these woodblock prints. And the arrows point to these small vessels that run along the length of the optic nerve. They supply blood to the optic nerve head. This is one of the many iconic images that we all use in ophthalmology to study those blood vessels as they come along the length of the optic nerve. And when they get to the back of the eye, they branch either directly into the eye or branches go into the optic nerve, which is shown slightly here to the right. So this one vessel distributes blood to the so-called choroid into the optic nerve. And in fact, there's a third location, an anastomotic circle that surrounds the optic nerve, presumably to supply it with more blood. In other words, presumably through evolution, it was understood to be vulnerable in this extra blood supply. But all of those three divisions come from the same posterior ciliary artery, and there's one on each side. Here's another way of looking at it, and you might focus your attention to these small vessels running along the length of the optic nerve. And they again branch to supply blood to the nerve head. Well, I hope you don't mind these pictures. There are a few like this. It is Halloween, I mean. So here we're looking, the eye socket is directly above. That white structure is the optic nerve, which I have reflected back so that you can see the ophthalmic artery. The ophthalmic artery, shown here with the yellow arrow, emerges from the large blood vessel, the carotid artery, that goes to the rest of the brain. This is the first division of the carotid artery. It goes into the eye socket, and it supplies all of the blood to the eye socket, including to those critical posterior ciliary arteries. There, I inject that vessel with a dye, and if you don't mind, I apologize. This is the human eye with surrounding fat tissue that contains the delicate blood vessels. The lower aspect is an example of how we make that tissue transparent so we can then use laser imagery to find those blood vessels that have been ejected. And what it results from that is just incredible. So to your right is the back of the eyeball. The green structure in the middle is the entire length of the optic nerve within the eye socket. To your left, in red, is where I injected the ophthalmic artery. So you can see branches of the ophthalmic artery. And this is in 4D, so we can look at those branches as they go along the length of the optic nerve. In this first successful example, this was March of 2024, I didn't quite get far enough to the optic nerve head. We went along the nerve, but wound up having to modify our techniques to reveal more blood vessels. And look what happened when we modified the technique. What I'm going to show you is the back of the eye. The optic nerve will be in the middle. It'll be surrounded by hundreds and hundreds of blood vessels. We're interested in these blood vessels because we want to understand blood flow to the nerve. The optic nerve is in the middle here. There are many blood vessels, too many to trace. So we're using an automated strategy to identify these blood vessels. And in doing so, we know the digital coordinates of each vessel and the lumen size of each vessel. Here's another example, our third success. The optic nerve here is in red. You can see the blood vessels going along the length of the optic nerve. The back of the eye is to your right. Oops, sorry, the back of your eye is to your right. Let's try this again. Yeah. The back of your eye is to your right, and you'll see some of the larger vessels then branch into smaller and smaller branches. Those branches will be supplying the optic nerve head. So because it's a digitized stage, we can move the stage in and out of the plane and look at these blood vessels. These are the ones we're critically interested in. And this is another way to look at it. We can use different lenses. This is a high resolution image, and you'll be able to see vessels as small as 5 microns approaching and entering the back of the eye. The optic nerve is the structure in the lower part. It's red here. The back of the eye is to your left this time. And here are those blood vessels. Okay, so on your left, one of the iconic images that I've studied for decades to try to understand the cause of an ion. On the right, the reality. There are many, many more blood vessels than we have ever realized, supplying blood to this critical zone. Some of that blood supply goes directly into the back of the eye. Some goes right into the nerve. You can see these 2 divisions. And there's a third one that you can't really see going to that circle surrounding the optic nerve head. So again, one large branch supplying 3 zones. Now, we're learning many peculiar things, but one of them is as these blood vessels approach the back of the eye, they're often incredibly tortuous. It's very counterintuitive. On the right, you can see where we've manually traced some of these images. If you just follow the green one, you can see it makes a loop before it then heads toward the optic nerve. So, of course, one would imagine it would distort blood flow. Here's another example of a blood vessel which divides and then reconnects with itself, oddly. So we're learning things that have never been seen before. But in doing so, in being able to identify individual vessels in this way, we can identify branch points, and this is where the connection to Dassault really comes in. Because we're not just trying to create pretty pictures. We're trying to understand blood flow. We're taking that anatomy, which has never been captured in a human eye before, and working with our engineering colleagues to develop a blood flow model. The hypothesis that we're operating under now is that, oddly, maybe perversely, through evolution, this one blood vessel, this posterior ciliary, which is, there's one on the right and one on the left, as it approaches the back of the eye, it distributes blood into 3 zones. But 2 of those zones are under arterial pressure, higher pressure. But the vessel that goes to the left up here supplies a huge, capacious, marsh-like zone called the choroid, which is under extremely low pressure. You need to get a lot of blood into the eye to supply the retina, then you have to get that blood out, and that's a low pressure system. So the hypothesis is that, and you can see here, if you look at the blood pressure on the left, that histogram, as the blood pressure goes down, the flow, we hypothesize, will reduce to the optic nerve in that circle. It continues to go into the marsh, but it progressively diminishes its flow into the optic nerve, oddly enough. So I think the hypothesis that this is a quirk of evolution, the way the eye has developed, the circle formed to provide additional blood, but there's still a vulnerability. So I'll end my section by saying it's not just about understanding blindness, although that's important. We're being able to look at blood flow and develop a model through small blood vessels, and we believe this will be relevant throughout the body. This has never been done before. Well, let me give you a common example. I see this every day in my practice. MRI scans are very high resolution. The middle of the brain, the great majority of the brain, are all interconnecting wires. That's what allows us to parallel process and have the intelligence that we do as primates. Over the age of 60, almost everybody has these white spots. Almost everyone. These are occurring in these parallel processing fibers. We know these are microvascular changes. It happens all the time, but we really don't know why. And so our model may have application, I think, for the brain, also for the kidney, the lungs, and the heart. But to make sense of this, it depends upon engineering, and Salwa and her team are working on developing this model.
Thank you, Dr. Rizzo, for laying out such an amazing clinical background for our project. Hello, everyone. Good morning. I'm here today to talk about the progress that we had been making from the modeling and simulation side of this project. So let's take a look at some of the works that we have done so far. So our overall goal when we started this project was to understand the interrelationships between the structural and hemodynamic components of the eye. So it is like a puzzle, and in order to solve this puzzle intuitively, we wanted to start off with a 3D model of the eye, and we created a generic 3D model where we added the components that was necessary in order to simulate the movement of the eye. That's something that we did in the past. And then after that, we wanted to move towards the hemodynamic aspect. So on top of the 3D model that we created, we also created some generic blood vessel network around the eye. These are more on the larger scale, like vessel diameter wise, and we just we did like a initial CFD simulation on them and tried to match the blood flow parameter range to the literature, the ranges available on the literature. And after that, we realized that there are some challenges if we want to answer some of the questions that Dr. Rizzo has. And the challenges are that there are hundreds and thousands of much smaller blood vessels downstream of those larger vessels that we see, that we have seen that Dr. Rizzo presented, arterioles, capillaries, and so on. So if we want to incorporate the effect of those in our simulation and try to have like an overall system of the blood vessel network, we need to go beyond the 3D modeling aspect. So we started thinking, what other modeling approach we can adopt for this project. So that's when we came up with the idea of applying systems behavioral modeling approach in our simulation. So in this approach, it helps us model complex systems with large number of components that are interdependent on each other. So how it works is that We look at a system, we lay out the map of the system, and then we include all the components of the system, and then we figure out the governing equations that are relating one component to the other. So we define the mathematical model, and then define the relationship connecting each component of the system. We define the inputs, outputs, and then we run the simulation, and then we have a better understanding of how the system changes as we change different components of the system. This is a behavioral modeling approach. This is a common approach that is being used in other industries as well, oftentimes in aerospace industry and automotive industry. So our goal is to apply this in the problem that we are trying to solve associated with blood vessel network. So here at the top picture, so here at the top picture, you can see the traditional modeling approach that we are showing. You can see the blood vessel networks that Dr. Rizzo showed us in the earlier pictures. And then at the bottom, we came up with that map that I was talking about. This map is basically representing, giving you a system's image of the blood vessel network that we want to model, basically. So as our initial step, we wanted to replicate a mathematical model of general central retinal vasculature that we found on the literature. And that model is the picture that you see here. It's a circuit model. So we are basically utilizing the fluid electric analogs. It's a very common approach when you are doing systems modeling with a fluid network. It's oftentimes used in the cardiovascular systems modeling. It's used to incorporate wind castle modeling for cardiovascular system. It's also oftentimes termed as reduced order modeling approach. So it's a, again, common practice, and we are trying to use it for our blood vessel model network in the eye. So this is something that we found on the literature, and the analog-wise, the fluid electric analog-wise, the way we look at it is the blood flowing through a vessel with systemic resistance and vascular compliance is equivalent to current flowing through circuit with resistance and capacitance. And then the pressure drop in the vessel is equivalent to voltage drop. So using that relationship and the guidance from this literature, we replicated that using our systems behavioral modeling tool that we have available on our 3D Experience platform, which is the Dymola software. And here you can see that we try to create a representation of that circuit on our Dymola. And this is the initial version of the model that we recreated. And our goal was to see if we can make this system reproduce some of the behavior that we are expecting. For example, we know that intraocular pressure has impact on the blood flow. So when the intraocular pressure increases, we expected to have a decrease in blood flow in this circuit. So we went ahead and we played around with the intraocular pressure value. Intraocular pressure is basically the pressure that you have in that what do you call, like the spherical section, like inside of the eye. That's the pressure. It's called intraocular pressure. So we increased the intraocular pressure, and we expected a decrease in the current flow, which is equivalent to the volumetric blood flow. A volumetric flow rate of the blood, and that's exactly what we saw. These different values that we used for the intraocular pressure, we saw the variance in the current. However, again, this is the very initial version of the replication, and currently we are working on fine-tuning some of the parameters that we have in the circuit in order to get results that matches exactly with the literature value. So just to summarize, we are currently working on applying the systems modeling approach in order to reproduce the complex vascular network near the optic nerve region. And this is the systems model map that we came up with. Right now, we are working on that first segment of the map, which associates with the central retinal artery vasculature. And after we can reproduce that faithfully on our Dymola software, we want to move forward with the posterior ciliary artery branches that Dr. Rizzo talked about. That's our main interest, region of interest. Using the fluid electric analog, we would like to create that circuit on the Dymola, and eventually, after we make that model, our goal would be to establish a connection between our systems model and the 3D model that we built in order to get a better understanding about the overall system, ocular system. With that, I would like to thank you, everyone, and I would like to conclude my presentation. And I would definitely like to thank, before I end, I would like to thank my coworker, Swati. She's sitting in the audience. She had been helping us a lot with her Dymola expertise. But yeah, thank you, everyone.
Thank you very much. Thank you. Is there any questions from the audience? Oh, yeah. Okay. One question.
Thanks for the talk. I'm interested in the difference in time scales when it comes to the simulations that you run and the time steps within the simulation, and the progression of blood flow or interocular pressure, if you will, degrading or even getting better. And this is in the context of folks who make lifestyle changes and let's say even do some non-pharmacological changes or exercises to slow down their vision from degrading and probably even like having some vision return. Where's the research in understanding, these things that we hear about, lifestyle changes and improving overall fitness, like in this case, eye fitness, as opposed to some of the work that you're doing where I imagine this is on a matter of seconds, but you've got microsecond or nanosecond sort of time steps.
Right. So from the simulation standpoint, so simulating a long, prolonged effect of something from the 3D perspective can be challenging. However, with the systems model, right now we are running our simulations for 1 cardiac cycle, let's say, but then with systems model, we can run the simulation for a longer period of time. And in terms of understanding, trying to relate our results to lifestyle changes, I guess, I personally think that sometimes simulations will be able to give you the direct information that you need, like to prescribe to the patients. Like, we saw, this is the effect that we see, and we think that this is going to be the long-term effect. You should modify your lifestyle in this way. I think that will work, but then sometimes we might have to make inferences. We may not be able to get all the answers from the simulation, but it will give us information that will be good enough for us to make, like, judgments, like informed decision making, basically. Yeah.
Thank you. Thank you very much.
Thank you. Thank you.
Well, thank you. Congratulations.